Hey, Joe, coming at you with a good friend of mine, Justin George, and we're here today on this podcast, and it's also going to be available on video. So if you do have YouTube, you can check us out there too. But this is a podcast that we wanted to make on a topic that him and I are pretty passionate about, and that is we want to do a podcast about what do you do when you're newly diagnosed with type 2 diabetes? What is the next steps? And we're not going to go through all. We're going to cover in this podcast two areas that we think you're going to really want to be aware of. And I think sometimes the fear is taken out of things when you're aware of it. And Justin is a hospital pharmacist, a clinician. He's got way more degrees than I do. I'm just a bachelor's in pharmacy. He's a doctor in pharmacy. I usually call him Dr. George, but sometimes I go with Justin. What's that, Justin?
Yeah, I don't know about that.
You know about the doctor part, huh? But yeah, that's Dr. George. Him and I, he was did a residency when I was a precept, and we had a great time. And I really have a lot of respect for this young man. He's done some great things in his life and his profession, and he's also raising a beautiful family, and he's also an author, a publisher. I could go on and on. But so, Justin, let's get to it for our audience. Newly diagnosed type 2 diabetes, what's next? And one of the things I want you to talk about is what are some of the most important things a newly diagnosed person should do relative to his doctor and maybe keeping up with his appointments? If you could share that.
Yeah, so definitely. So basically, in diagnosing diabetes, there's two types. There's type 1 diabetes, which is where your pancreas can't secrete insulin or very little. And type 2 diabetes is when your pancreas can't really keep up with, the sugar. So they're kind of both the same principle in that, insulin is kind of like the key that unlocks the door in your cells that allows sugar from the bloodstream to go into the cell. And then the cell can use that sugar to break it down, use it for energy, and carry out all the cell functions. And sometimes, for people, they don't have the key, so that the sugar kind of hangs out in the bloodstream, and that's what causes a lot of the damage. Some people may remember last summer, July 2021, I think, there was a giant condo building in Miami that collapsed.
Yeah, I remember.
It was called the Surfside condo. And one of the theories in how this building collapsed is that because of rising sea levels, seawater was making its way into the foundation of the building, eating away at the concrete, eating away at the rebar, and it weakened the structure to the point where, it partially collapsed. And, tragic incident, hundreds of people died, but, it kind of draws a parallel to what happens in the body when sugar is hanging around, because just like, salt water, which wreaks havoc on electronics and metal, sugar is also a corrosive substance in the body. And, the primary role of insulin is to take that out of the bloodstream and into the cells where it needs to be. So that's why patients who are uncontrolled in terms of diabetes, they have issues with their vasculature, their veins. It causes damage to the arteries, to nerve endings, which is why people with uncontrolled diabetes have vision problems. It causes neuropathy or pain in the nerves. So sugar can be a damaging substance, especially when it's not managed correctly. So that's kind of what diabetes is in a nutshell. And how people are diagnosed is there's a blood test called an A1C or What the A1C does is it measures how well the body controls sugar over a 120-day span. And the reason why it's 120 days is because the average life cycle of a red blood cell, which is where hemoglobin attaches to, is about 120 days. So it gives you a pretty good range of how well the body's doing. And for most people, you want your A1C to be under 5.7%.
What was that number again?
5.7%.
Okay.
And then once it goes over 5.7, then you become pre-diabetic.
Yeah.
And so that's when, the conversation starts with the doctor about, here you're pre-diabetic, you might want to get your sugar under control, because if you don't, then you might, progress further and become an actual diabetic. So once your A1C goes above 6.5%, that is when a diagnosis can be made for diabetes.
6.5%. So
6.5.
in the beginning, it's very important that they keep their appointments. First off, the doctor is going to diagnose. Is he going to run some other tests? He's going to do an A1C. Is he going to do anything else like a fasting blood sugar? Or?
Oh yeah, so there is also a oral glucose tolerance test, which
Yeah.
is basically they give you like a ridiculous amount of sugar. My wife had to do it when she was pregnant with both our kids because they also look for gestational diabetes
Yeah.
when when you're expecting a child. So she had to drink like this really sugary liquid, and it was like an orange soda, and then they give you like a cookie. I mean, they just throw a giant Domino's sugar packet at you,
Yeah. Yeah.
and then see what your body does. And theoretically, if your body's able to handle all that, your sugar should not spike. Your pancreas should be able to secrete enough insulin to manage that spike in your blood sugar, and then keep you steady. And if there obviously is a spike in blood sugar afterwards, and it's sustained, then that could be a sign that the person has diabetes.
So they're going to do an A1C to see if you're above 6.5. They're going to do a glucose tolerance test. Those are a couple of things. Now, one of the things, if you could just share briefly, I don't think people understand in the beginning just how important it is for them to go back and see their doctor. Whatever schedule he has, they got to go back and keep those appointments, no?
Oh yeah, definitely. Because the longer that you leave diabetes untreated, the more damage it is doing to your system. And you want to make sure that you get ahead of this as fast as possible. And especially now with the pandemic or post-pandemic, whatever phase of this we're in, doctors' offices are booked solid, and there are less doctors available to handle the patients. And patients are sicker now. We're not getting enough care, and there's been a mass exodus of healthcare workers on top of that. So getting an appointment now is extremely difficult. So if you've had an A1C that's been elevated, or you've had blood sugar readings that have been elevated, it's very important to keep that follow up with the doctor, because you need to get ahead of it as soon as possible.
And there might be quite a few visits in the beginning, especially. And if you have a meter, we're going to talk about meters next. But I think the takeaway from that is some of my patients, they come in and they say, "Yeah, I got to get back to the doctor. I've been diagnosed." And I've really stressed them. I say, "Look, don't miss those appointments, because right now we got to get you dialed in. We got to find out what's going on." So, but talk to me about testing. And I'm a newly diagnosed type 2, let's say. What am I looking at with testing? And maybe you can share a little about the different types of testing. But let's assume that I'm a mild to moderate new case and I need to start testing. What's going to happen there?
Yeah, so there's so many different types of glucose meters out there, and they all use different kind of test strips, and they all cost different amounts. But the basic premise is, you prick your finger, and there are different types of ways to do that. There are a lot of new lancets now that are much less painful than the old style. My grandma was a diabetic for many years, and I remember when I was a kid, so in the 90s, she would take this little blue lancet, and she would just stab her finger
Yeah.
without any like, not even the slightest flinch, and she would put the drop of blood on the test strip and put it in the glucometer. And yeah, I thought that was the craziest thing, and I'm like, oh, I can't do that. Then of course they, nowadays, I mean, they've come up with like the super thin, needles that you barely feel. So it's
33
come a long way.
They've come a long ways with that. So a new diabetic's going to be testing once a day?
So they're probably going to be testing. Depends on how uncontrolled they are. If their A1C is really high and they've been to the hospital,
Yeah.
and they might be having to test 2 or 3 times a day. It all depends on how uncontrolled, I guess, they are. If they're not really that high, then you could probably get away with testing just once a day. But it all depends on what the doctor decides and what's appropriate for the patient.
And again, we're going back to the fact that they really need to be tight with their doc, because otherwise they're not going to know how often they're going to miss an opportunity. Their A1C is going to go higher if they stay above 250, and that, oh my gosh, their A1C is just going to keep ratcheting up. And they're going to go back and they're going to be like, what have you been doing? Now, some of these meters now, it's kind of cool. Then we're going to move on real quickly and land this plane. I want to talk real quickly about how great these are now that the doc can actually see your numbers. And I think actually some of them you can even download and send it to them. So the doc can see what your numbers and your ranges are. And I think we should encourage people. I know I encourage my patients is make sure if he wants that data, you get it to him, especially if you're doing readings correct, Justin, but 2 hours postprandial, the rising blood sugar in the morning, correct?
Yes. Yep. So you want to get your blood sugar right in the morning when you wake up before breakfast. So then you could see, how well it's been managed overnight. And then you want to obviously wait 2 hours after eating so that you give your body enough time to digest all the food so you can get an accurate reading.
And then the CGMs, the continuous glucose monitors, are a new thing now. And I think there's some type 2s, if they're trying to dial them in and they're not doing well, that would be a good option, correct?
Oh, yeah. So my dad is pre-diabetic and he has the Freestyle Libra
Mm-hmm.
and he really loves it because it's a pod that goes on the arm and you have to switch it out every couple of days.
Yeah.
But it's super easy to apply and you get to read it on your phone. And the phone actually alerts you if your blood sugar is going too low. It also alerts you when it go too high, and it gives you a pretty good history of what your blood sugar is doing throughout the day. And this thing, it measures constantly. It's like a very small cannula that goes into the skin, and it analyzes the very small amount of blood that's in that top level, that top layer of the skin. It's really cool how it works.
Yeah.
And so when you go to the doctor's office, you can show them your phone. You can maybe export it as a file, and then they can see what's going on with your sugar.
So CGM is going to be it's kind of the new way. The prices are coming down. It's a little bit more pricey. So I tell people that type 2, I said, hey, this is going to get you a little bit better measures, obviously, but they're a little bit more pricey. And that's what's contributing to the cost right now for a lot of people out of pocket, unfortunately. Some insurances cover it. But diabetes is an expensive proposition. I just did a video on that. If you want to check it out, I think it's also a podcast about the cost of type 2 diabetes. You're looking at anywhere from $2,400 to $3,000 on a medium end, and on a higher end about $4,000. So now, Justin, we're going to move on to the next thing. But I wanted you, before we wrap this up, is to mention in the next podcast you're going to cover some things about the medication therapy and how we go about that. So can you briefly kind of give them a little tease about the next podcast?
Oh, yeah. So there are tons of different classes of medications when it comes to treating diabetes. So you have a whole set of oral medications, which are all mostly tablets and capsules. Then you have insulin, which is an injectable. And then you have a couple of other injectable medications that help kind of manage your postprandial glucose, which is your sugar after you eat. So basically, the gist of it is you try to start with lifestyle modifications first. If you're not too uncontrolled, your A1C is not like sky high. And then if that doesn't work, then they add usually metformin and then kind of go from there. So in the next podcast, we can delve into what the drugs are, what the different classes are, and, kind of what the steps are.
Well, I think it's going to be an important part, and that's what a lot of people want to get to. But we want to make the point that, hey, before that, you got to really get a handle on the labs. You got to get a handle on the testing because there's a lot of that. And then, of course, the next thing is the medication. And unfortunately, most of my patients start out, and you've seen this, 1 or 2 medications within sometimes, if they don't really do a good job with lifestyle modification, within 6 months, maybe 18 months, they're on 5 or 6. We'll talk about some of the comorbidities. But here's the thing I want to end with, and then we're going to let Justin go. And I really appreciate your time, by the way, son. So
thank you, Joe. It's always a pleasure to be on here. I feel famous.
One of the things I wanted to mention, I think you're on board with this, so that's why you're taking time away from your family to do these podcasts, is doggone it, folks. This is one of the few disease states that I know of that you can put in remission. Now, I'm not going to say you can cure it. I'm not going to say it's going to be gone. I'm not going to say you're going to lose the diagnosis, but we've seen time and time again, if you can be below 6.5 A1C for 3 months, they consider you remission. Now, Justin, you and I both know that if somebody can stay on track and gets healthier and healthier, it really dials in their diet and real dials in their activity, they probably can stay in remission pretty much long term. Once in a while, they might have something where their genes are going to kick it up, and not most of the time. And here's another statistic that I want to leave you with, folks. 40% of the time, if you're a newly diagnosed type 2 and it hasn't been too long and you're not really out of control, 40% of the time, if you got to normal weight, that diagnosis is going to be gone. It's going to be called remission. 40%. So that's why I'm being kind of obnoxious. People say, do you want to talk about anything but diabetes lately? Some of my fans, they're like, is there anything else? I said, look, I believe this is a big deal. And right now, if we don't talk about it and show people that they can control this. When I got to normal weight, I lost my blood pressure medications. My doctor, with his advice, says we're going to try to drop one at a time. And I was able to lose my cholesterol medications. But people with type 2 diabetes, we have several clients that we work with that have been able to, with their doctor's instruction, and really staying tight with their doctors and really following through with the follow through appointments, maybe every 3 months or 6 months to make sure it's not, on the fringe of coming back. They've been able to stay off a lot of the medications. Some of them, not all the medications, but then we reduce them. So anyway, Justin, thanks so much. In the next podcast, we'll dive a little deeper. And folks, if you need some information about maybe how you can get yourself on track, check out our website, RxHealthyHabits.com. A lot of information there about lifestyle, healthy habits, cooking, but also a lot of good information about weight management, weight control, especially long term. So, Justin, thanks so much again. And I'm looking forward to the next podcast with you, son.
All right. Thank you, Joe.